Hello everyone, I'm Dr.Prachee Kulkarni, fertility specialist, 49 Fertility Center. Today I'm going to talk about hysteroscopy. So what is hysteroscopy, how it is done, what issues are dealt with the procedure of hysteroscopy. So hysteroscopy is actually an endoscopic procedure, which means it is minimally invasive and it is done to visualize the inside of the uterine cavity. So there is a hysteroscope which is half the size of a pen, and a camera is attached to the hysteroscope so that when we enter the uterus with the hysteroscope, we can visualize the inside of the cavity on a separate screen which is attached to the camera. So if suppose this is an hysteroscope, what we do is we enter through the vagina, we see the natural opening of your uterus, which is the cervix, and we take the hysteroscope inside the uterine cavity through the cervix. So after reaching the uterine cavity, what we see is inside of the uterine cavity, which is the fundus of the uterus, the openings of the tubes, and the cavity of the uterus, which also tells me about how your endometrium is. Are there any adhesions? Is there any septum? Is there any polyp? Is there any submucous fibroid? So whatever is going inside the uterine cavity, I can visualize after putting in the hysteroscope with the camera over here in the uterine cavity. What I cannot see is outside of the uterus. I cannot see the outside of the tubes. I cannot see the ovaries. So for that purpose, what is required is laparoscopy. But today we are discussing hysteroscopy. So hysteroscopy usually is advised for any problems to deal with the uterus. So what can be these problems? We can divide these problems related to infertility or general gynecological problems. So general gynecological problems could be heavy menstrual bleeding, to diagnose any polyp or to take care of any polyp, or even for the procedures where we will curate the lining of the uterus with the thermal energy so that it as a treatment for the AUB or abnormal uterine bleeding. So these are the gynecological indications for the hysteroscopy. Sometimes even for the sterilization procedures wherein we can put the spring-like equipments inside the tubal openings, we can perform it hysteroscopically. So this is about the gynecological indications. What could be the indications in fertility is we need to see inside of the uterine cavity to rule out any minor adhesions, any problems with the lining of the uterus, any polyps in the uterus which is diagnosed on sonography, or any submucous fibroid, or any septum of the uterus which may require correction. So it can be diagnostic hysteroscopy or it can be an operative hysteroscopy. Usually we perform more often, which is operative hysteroscopy, because most of these things are diagnosed on ultrasonography. So what we do is, if suppose polyp is present, polyp is a growth of the endometrial layer, which is a benign growth. So after reaching inside of the uterine cavity, we look for that polyp. We approach the base of the polyp and we cut the polyp from the base. So this polyp now can be sent for histopathology and it is out, so that now next cycle you can undergo your fertility treatment like embryo transfer, and once the polyp is removed, the chances definitely improve. If there are any adhesions means the lining of the uterus getting stuck to each other by fibrous strands. So if we see such fibrous strands inside the uterine cavity, what we can do is adhesiolysis. We cut open those adhesions with the scissors, so that now uterus is now open to receive the embryo in the next cycle, so that it becomes more implantation chances improve. So this is about the adhesions. So if we can take care of the adhesions, we can remove the polyp. If there is any septum in the uterine cavity, we can cut the septum and make the cavity adequate before you conceive in IVF cycle, before embryo transfer. Also, if we see any submucous fibroid, means the fibroid which is going inside the uterine cavity, we can remove that submucous fibroid also hysteroscopically, so that next cycle you can undergo your embryo transfer procedure, and so that you can proceed with your treatment further. So this is about the hysteroscopic procedures. So hysteroscopy can be operative, can be diagnostic. Operative hysteroscopy can take care of polyp, your abnormal uterine bleeding, submucous fibroid, adhesions, septum. Also, operative hysteroscopy will tell me about if any history of abnormal uterine bleeding, any particular area which looks abnormal or polypoidal. We can take a guided biopsy from that particular area for better diagnosis. When we take a biopsy, which is like a blind procedure, just by putting in a biopsy catheter and taking out the sample, it's always better to have a look at the cavity and take the biopsy from the area which looks more suspicious. So this is about the hysteroscopy. So how it is done? It's a daycare procedure. So usually we advise the patients to come NBM, that is without eating or drinking anything. And this procedure is done under short general anesthesia. After the anesthesia, you will not come to know the procedure when it is happening. After the procedure, once you are awake, you may experience little vaginal spotting or mild abdominal pain only for a day or two. So this is about the hysteroscopy procedure. So we usually advise these procedures before IVF embryo transfer cycle. If at all there are failed transfers, if at all there is presence of polyp or septum or submucous fibroid, so that we can correct these factors and improve your chances of pregnancy. Thank you.